Hi, and welcome to today's episode of Live Healthy Now. This month is Breast Cancer Awareness Month, and sadly, we all know someone touched by breast cancer. So, I wanted to bring you an episode focusing just on this topic. Breast cancer occurs in every country in the world, and the rate of breast cancer in women has doubled over the past 50 years. A woman born after 1960 and living in the UK has an estimated 1 in 7 lifetime risk of developing breast cancer, and that's around 1 in 8 in the USA. And I also read that every 10 minutes, one woman here in the UK is diagnosed with breast cancer, making it the most common type of cancer. Now, thankfully, we have seen many advancements in the treatment of breast cancer due to the great research and development that's taken place globally. So that survival rates have vastly improved. Around 95% of women will survive their cancer for 1 year after diagnosis, and around 85% of women will survive for 5 years or more post the diagnosis. But of course, it brings with it lots of life changes, and not just for yourself, for your family as well. So if you are diagnosed with breast cancer, there's a lot of change and fear that you are going to encounter. So regardless of the improvements we've seen in survival rate, it's a disease that we do really want to protect ourselves from and watch out for those early warning signs and symptoms. So today I'm going to be chatting with a fantastic guest about this, and she's also going to be helping us to know when and how we should be checking our breasts and what to look out for. So welcome to the podcast, Amy Dave. Amy is a physician assistant in the US with almost 10 years of experience working in oncology, which, if anyone isn't familiar with that term, that is with cancer and different types of cancer, which Amy can share more about. And she's also a 2-time cancer survivor herself who now coaches other women as they go through cancer. So welcome to the podcast, Amy.
Thank you so much for having me, Nicola. I'm excited to be here.
Yeah, I'm really excited to have you join us and share your great wisdom and some of your story. But before we dive into that, I'll kick off with a question I like to ask all of our guests at the start, just to find out a little bit more about your healthy lifestyle. So, what would you say is your most impactful healthy habit?
I think it's got to be the food that I eat and the choices that I make, because I feel it immediately if I make a few days of suboptimal choices. My migraines come back, my cravings come back, I get cramps, I get bloated, my mood is off. So I think the food is the big one, because if I didn't exercise for a month, I wouldn't feel that different. But if the food gives me like an immediate cue that, something's off track, we gotta get back on.
Yeah, so what kind of foods help you the most to feel well and strong?
So lots of vegetables. I make sure to include them in almost every meal. And then high in the cruciferous vegetables, so broccoli, cauliflower, Brussels sprouts, things that really help the liver to detoxify.
Oh, that's great. Thanks for sharing that. And yeah, I know certainly with me, like what you explained, if I've had a few days of eating not so well, especially if I've had lots of sugary foods and, heavy carbohydrates, bready food, pizza and things like that, I can feel really sluggish. So yeah, it's great that you called out how big a part food plays in your health and well-being. So I'd love to start really, Amy, with you sharing your story of how you were diagnosed with cancer, what happened to yourself as you went through treatment, to where you are now, helping other women to navigate their own cancer journey.
Yeah, so when I was 23 and newly married, I was diagnosed with a non-Hodgkin's lymphoma. Out of the blue, we still don't know to this day why I got it, but I did. And so the treatment for that is chemotherapy and then radiation therapy. And because the lymphoma was in the chest, it was radiation therapy to the chest. And the doctors had told me right at that time that, listen, in about 15 to 20 years, your chance of developing breast cancer is about 40%. So they had warned me right at that time. And because of that, I had started my screening mammograms at the age of 35, which is early. 40 is the recommended age. But I had started at 35, and I actually had a couple of things that were found that were benign. And then when I was 39, they did find a very small early stage breast cancer. And because I already had the maximum radiation dose at that time, the only treatment option I had available was surgery. So I had surgery, and at that time, my kids were still young. They were in elementary school. So, the recovery process was a little bit challenging, but thankfully I have a lot of support at home with my husband and my parents and, extended family and everybody else. So we got through it.
Yeah. And that's a huge thing to go through, especially because it was the second time you'd been diagnosed with cancer. So I imagine it was a very scary time because your treatment options were so limited. Like, how did it feel knowing that that was the only route available for you?
I feel confident about it because I know that early stage breast cancer can be treated with surgery and then medication, which is I just take a pill every day now. So, and what we had done was a bilateral mastectomy. So we prophylactically removed the other side also, just so that if there was any chance of something there, that we got rid of that also.
Yeah, so that felt like the right decision to make to protect yourself for the future because of that higher risk you were at due to the treatment you'd had initially for the first cancer diagnosis. And, you're now working as a health and wellness coach. We've known each other a while, and you're building a new business, and you're really passionate about helping others who are going through a cancer diagnosis because, as you know from the work you've done in the healthcare system for many years, it's something that really does turn your life upside down, doesn't it?
Yeah. I have a dual perspective of being a patient and a provider in the same field.
Yeah.
And it is definitely an emotional roller coaster. I've had some really great doctors and providers, and I've had some not so great doctors and providers who didn't really listen and who didn't, understand what I was going through. Even my family, as supportive as they were, I would tell them, like, listen, my mom had made my favorite, meal of eggplant parmesan, and I was like, it tastes like the pizza box, right? Right? Because my taste buds were all altered from the chemotherapy and stuff. So it's like they didn't get that. Or, I still remember this was years and years ago, but I was given medication to help bring my blood counts up, which happens when you're on chemotherapy. And the blood cells are made in the bone. And my bones would like shake in the middle of the night. And I was in so much pain. I could feel them vibrating. And everyone's looking at me like, what do you mean your bones are vibrating? Like, I don't know, but I can feel it. Something's going on. But yes, having that perspective has helped me treat patients and empathize with them because I know what they're going through.
And have you shared your story with patients to help them through their own journey, and to show them that you do really understand from both sides of the fence?
Yep, sometimes, depending on the patient, if they're really struggling with the issue, like when I used to work in radiation oncology, I would show them, I don't know if you can see, there's a little tattoo here. And I say, oh, you get a bunch of these little tattoos where we mark your radiation field. And I'm like, it just looks like a freckle. It's no big deal. But yes, I could definitely, even with the surgery, I had a 6-week recovery, and it was a rough time. And so I can tell patients, yes, you're going to be out of commission for a couple of weeks. You're not going to be doing everything that you used to do, but you will go back to a normal life. You'll be fine as long as you take care of yourself, you know.
Yeah.
Definitely it was easier to understand my patients, and if they had any challenges or questions, I could really explain it to them.
And so now that you're moving on from what you've done in the healthcare system to support people from a medical point of view, you're moving more onto that coaching side, the lifestyle side, creating habits to really support yourself as you go through or recover from cancer treatment. And so why do you think it is that that's so important? You know, because I think so many of us, when we talk about cancer, I think about you really focus on that you know, that treatment process in the healthcare system, don't you? And then there's a lot more that happens. You know, is that why you've come in to do what you're doing now?
Yes. So when I had the surgery, I had a plastic surgeon who was amazing. I've never met anyone else like her in the whole world. She was the most thorough and detailed, you know, physician, but on the other hand, she also had the most amazing bedside manner. She was compassionate, she cared, she actually gave me a hug, you know, when I went in for the visit and said, oh, you know, I'm going to help you in any way I can. And so a key part of my recovery was her advice to me. And so she had given me like this whole page of, you need to eat extra protein, you need healthy fats, you need, I think it was like a cup of nuts a day she told me to eat in the first few weeks after surgery. So she was like, your body needs to have the nutrients to build new tissue to recover. So she had given me like a whole page of things that I could eat and do. And I think, you know, I've always been big on health and wellness, but I think that kind of pushed me to say, oh, you know, there's food can do a whole lot, you know, to help heal, to help make new tissue. It's just, yeah, that's, I think, what helped me realize that coaching was one of the things I wanted to do.
I know myself from speaking to lots of different people, male and female, who've experienced cancer. There's often a lot of support, certainly in the UK here, when you're diagnosed and as you progress through the treatment from the healthcare system. And we have nurses called Macmillan nurses who were charity funded. They're a big part of the NHS process for cancer. Amazing, you know, people who support through Macmillan. But then the doors kind of closed and you're left to your own devices. There isn't really anything there to help you with normal life. And I know Gabby, who was on the podcast way back at the start, who also had breast cancer, she talked about being kind of shunted away and almost made the feel grateful that it was time to go back to normal life. And certainly family and friends were like, well, that's great, your treatment's finished, you can get back to life now. But she didn't want to go back to her old life because she realised that was possibly a big factor in her diagnosis. But nobody helped her with thinking about food or thinking about exercise or thinking about sleep and stress and the other lifestyle factors that can, you know, affect both your future risk of new cancer, but also your recovery, as you say, to physically and mentally recover, because there's a huge mental and emotional part of being diagnosed and going through cancer, isn't there?
Yeah. And even like you had mentioned with the physical aspects, you know, when you're undergoing 6 months of chemotherapy, you are out of shape, completely out of shape. So even if you were exercising before your diagnosis, you can't go back to the same types of exercises or the same intensity. So you really have to start back at step one and say, okay, maybe I could just go for a walk around my block. You know, maybe I used to run 3 miles, whatever, before, and now I can just walk around the block. But, you know, that's every time I was sick, I always made it a point like, okay, I'm going to do everything I can to stay healthy this time. I'm going to, you know, be well. And I did. I improved my, you know, wellness habits each time I was in the hospital and all of these things. So The physical aspects are definitely very different from what you were before your treatments to after your treatments. Even after surgery, you're resting for 6 weeks, so your conditioning is a little bit less. Your deep breathing might not be as deep because the anesthesia can affect your lungs as to how big of a breath you can take. The emotional aspects, it's just, that's a roller coaster, and that's a lot of mindset work that just needs to happen. A lot of positive affirmations. You have to deal with the worry, the stress, if you have family to take care of, there's a lot going on.
Yeah, definitely. A lot of it comes back to like self-compassion and acceptance, because, as you say, things may have changed and mean that you can't have the same habits. And we know habits form our identity. They're a huge part of who we are and how we live and feel. And so when they change, and I know this is completely different, but I've had a bad back for quite a few weeks. And for the first 3 or 4 weeks, I was in a lot of pain, and I haven't been able to exercise now for quite a few weeks. I'm seeing an osteopath, and that was really, really hard. It still is hard not exercising. But the first few weeks, I just felt all over the place, because for me, it's such a huge part of my mental health. And so I've had to even just work on that. So then, to multiply that to someone who's had an operation and is, accepting of changes that have come because of maybe the operation physically, and also that haven't had cancer or still, going through the treatment. So there's so much to comprehend. And I think with breast cancer specifically, and why it is a disease that, most women fear, is because it can really affect like your personal self-esteem and self-worth, can't it? Because of, what many women feel about their breasts and the part that they play in our identity and so on. So there's a huge piece there, depending on, what treatment you have, like yourself with the mastectomy, that can really affect you in many different ways psychologically. So, I know, as I said right at the start, we are fortunately seeing much better improved survival rates, but it's still a disease that can absolutely change so much of who you are and your identity, can't it?
Yes, of course. And it becomes a part of you. It's just who you are now.
Yeah.
I'm a survivor, and it's been 5 years and counting. So, it's just who I am now. I relate to a whole new group of people.
Yeah, and that's amazing that you're 5 years forward now and you're feeling really healthy and strong, and you have this new passion to help others, because one of the key things with breast cancer is early detection and diagnosis, isn't it? That massively increases your survival rate and also the type of treatment that you potentially need.
Yep. So I just released a YouTube video on this, but there are 3 steps to screening. And the first one is something that you do at home every month. And it's recommended, if you're still having your monthly bleed, to check your breast right after the monthly bleed. And while you're in the shower, you just take your 3 fingers and just press, start in the center of the breast, work your way out, press all the way down. If you feel anything, lumps, pain, discomfort, swelling, if you're having any discharge, you check with your doctor right away, make an appointment to go see them. That's the easiest way to check yourself, and the most, regular way, because you know your breast more better than anybody else, right? So the second thing you would do is make sure you're getting an annual exam from a healthcare provider. So whether it's a family doctor or your OBGYN, or somebody needs to be checking the breast the same way you do, but they know what they're looking for a little bit better. So that would be an annual exam. And then the third thing for women, it's recommended for most women after age 40. But if you're at higher risk, you start at 35 to have the mammogram, which is an uncomfortable, annoying test. But that discomfort is nothing compared to the treatments for an advanced stage cancer that's found in the later stages.
So we'll break that down a bit. I really want people to
Mm-hmm.
take this on board and put it into place, me included, because I don't regularly check my breasts. I have had some lumps detected twice and I was referred. Both of them were absolutely fine. They were down to the thickening of breast tissue. Apparently, I have very thick breast tissue, and the last time that I had them investigated was less than 2 years ago. It was definitely post COVID and so on. And the whole experience for me was very quick, very comfortable and simple. But it was very interesting talking to the consultant and the radiographer when I had the exam and then the ultrasound and mammogram. Just what they were saying about breasts that you have no idea about. I was asking about the breast tissue, and is it because I've got bigger boobs that I have thicker breast tissue? And they were saying absolutely not. And then they were explaining about men and how men get breast cancer too, and how men can have very thick breast tissue, but it doesn't mean that they've got a pair of breasts as such. You could just look at them and it still looks like a normal male chest, but they have that thick breast tissue. And so they were saying in women it's the same. It doesn't matter what size your breasts are. You can have very thin breast tissue, very thick. You can have very lumpy breasts that react a lot hormonally and change through your cycle. So to your first point of checking yourself regularly, you said something at the back end of that about your own breasts best. And I really like that saying, because that's the advice, isn't it? Get familiar with your breasts throughout the cycle, because sometimes you change a lot. Certainly before I was perimenopausal, I had very reactive breasts. I've noticed this year, since I've really shifted into that perimenopause stage, it's not happening as much. But I could have severe swelling and breast pain for 2 weeks of the month, for months and months and months, and then I might have very little, or I might just get it a couple of days before my period was due. So I could be very, up and down with the changes in my breasts. So definitely get familiar and know them. And you said your 3 fingers, so the flats of your 3 middle fingers,
Yep. So you use the tips of the...
right.
Yep. And then you just start in the center, make a tight circle. If you actually watch my YouTube video, I use a little prop and I go through it. But yeah, you start with your fingers, you push down, and then you kind of spiral outwards until you cover the whole breast, and you want to include the underarm area as well.
And that's really important, isn't it, as well? Because your lymph nodes are in the underarm, and sometimes that's where you can feel the swelling because of the cancer. Yep. So the other thing I wanted to ask you about with this is when we talk about the early detection of signs and symptoms, because I know that many women just think about lumps, but it isn't just lumps that can be a sign of something being wrong and potentially being cancerous, can it?
Yep. Well, most women don't have any symptoms, especially if you catch it early. So you wouldn't feel anything different if it was only, a 1 centimeter, 2 centimeter nodule, unless you felt it. Right. But some women can have a thickening of the skin. So in the medical community, we say it looks like an orange peel almost. But if you notice any changes in your skin, if you're having any kind of nipple discharge that you shouldn't be having, if you're feeling anything, a lump or anything that's different, you want to have your doctor check it out.
Great advice.
They'll do an exam pretty similar to what I just explained how you do it at home. They're going to check the same thing. They'll check both breasts. They'll check the underarm area. And then they'll probably recommend you for either a mammogram, an ultrasound, or an MRI or something to look at it. If they feel something, they could just, say, hey, you might need a biopsy of this. But they'll probably do some imaging, and then if they need to, a biopsy. But it's really like, get to know yourself. If you notice anything different or new, just have it checked out.
Yeah. And I wanted to touch on the second and third points that you gave, because here in the UK, it's very different. We can't have that once a year check unless you've potentially got some kind of private healthcare. Obviously, we have the NHS here, and we aren't, on your third point, invited for those mammograms as routine until we're between the age of 50 and 53, so much older than in the US. I know obviously you have to pay a lot for insurance for healthcare because it's a private health system as opposed to our NHS, but you're screened much younger as routine, whereas here in the UK it is much older. So it's even more important to check your own breasts all of the time, because you aren't going to get that once a year reminder to go in and have them checked by a doctor until you get to the stage of the mammograms, which are every 3 years until you're 71. I don't know whether there are certain guidelines that change that depending on whether you've had previous cancers and risks in your family and genes and so on. There probably is, but routinely it's 50 to 53 for your first one in the UK, and then every 3 years until 71. Whereas in the US you've got that annual checkup and then your mammogram screening from age 40 or younger if there's a reason for that. So yeah, a little bit different here. If you're in the US, definitely be taking advantage of what you have on your insurance provision to get those mammograms. And as you said, I've had one. It's not very comfortable, but oh my God, it's so much better than a smear test. And a smear test is something that we all should be doing very regularly and in line with your guidelines as well, to make sure that you're screened for that. So a mammogram is so much more comfortable, although it isn't the easiest and nicest of things to have your boobs squashed between a machine. And that's when big breasts are best, because it's easier, I think, the bigger they are to get them in there, isn't it? Which they were telling me about that as well.
Yeah, so I had the opposite problem. Mine were, small, and it was so hard, and the machine is squeezing, so hard. I'm like, oh my goodness, this is crazy. But yeah, and here a lot of the insurance companies cover it as a preventative test too. So,
brilliant.
Not a lot, but yeah, a lot of preventative services are covered. So.
Yeah, so to know what you've got and then react when you do find something unusual, because I bet you're the same, and you will have seen that with patients. People don't go straight away, and I was in that bracket. I had pain around the lump that I discovered, and I waited a couple of months before I went to get it checked. And then when I did get it checked, the doctor had said, I'm pretty sure it's absolutely nothing. I'm not going to refer you because I'm so certain it's muscular and that it will ease itself. You do a lot of workouts, but it didn't feel like it was in a place. Like, it didn't feel as though it was behind my chest bone or the breastbone. It really felt as though it was in the breast, but he was a doctor, so I took his word, and he said, give it a few months and see whether it heals. And I'd waited about 6-7 months and it hadn't. I had a lot of pain. It was actually getting, I thought, bigger, the lump, and more pain. And then we went into COVID and lockdown. And so by the time I went to get it checked, I think I'd had that lump for almost 2 years. So I waited well over 1.5 years, longer than he said, to wait before I went back to get it checked. And some of that was because I just kept thinking, well, he said that it wasn't anything. But then I did get a bit scared because of what I could feel and how it had changed. And then I did get referred. And what I'll say is about, that process in the UK is that it's so quick, and it really is, very reassuring to know that if they think there's anything wrong, you are referred very quickly to your local breast clinic. I think the NHS guidelines are that you will be seen if it's a risk of cancer within a couple of weeks. So I think you have to get your appointment within 7 days, and then go to the appointment from 14 days after, or within 14 days from there. And then they will do all of the tests that they can on that day and give you a diagnosis that day, unless it needs a biopsy sent in away to be checked and analysed. So it is very quick, and the people who work there were amazing. So, that's fantastic. And I think that's something that we've really seen improve as well, with the treatments and investment in cancer to help reduce the rates of death and increase our survival rates. There's so much there now to support you, and great people like yourself who work in oncology to give you what you need.
It's way back when I was working in radiation oncology, this is more than 15 years ago now, but I had a patient come in and we said, "What happened?" She said, "Oh, my husband found a lump on her. She didn't even know." And he ended up being the one saying, "Hey, what's this? Maybe you should go get it checked out." And lo and behold, it was cancer. So you never know.
Yeah.
But yeah.
Absolutely. And so that taking action is really important, isn't it? Because I have spoke to lots of people who've waited months and months, and unfortunately sometimes by the time they have had the tests done, then that's stage 4, and it does need very invasive treatment and unfortunately can spread. So one of the things I wanted to ask you about as well, because of your knowledge and expertise, both professionally and in your experience, is around the lifestyle risks of breast cancer, because there's so much we still don't understand about the causes of not just breast cancer but many of the cancers. But the thing that we do know for sure with all cancers, and some more than others, is how big a part lifestyle has to play. We know that genes can put you at greater risk, but in most cancers, and breast cancer included, it's very, very rare that your genes are 100% the cause of your cancer. A lot of it is lifestyle related. So, what are some of the things that you would suggest to people listening to consider when it comes to lowering their own risks?
So no smoking is one. You want to maintain an ideal body weight, because if you have too much body fat, the excess estrogen can be stored in that body fat. And we do know that some cancers, depending on the type it is, they feed off of the estrogen at times. So, you want to maintain an ideal body weight with healthy diet, exercise, things like that.
And just on
if
that,
you're
Amy,
prone to...
Sorry, I was just going to say on that, with weight, it's even more important once you post or get into that perimenopause, menopause stage and beyond, to manage your weight, because you're at a much greater risk from that point in your life because of the hormone shifts of that higher risk because of the fat storage and estrogen, isn't it? Yeah.
And also, if you're prone to breast cysts, which are, fluid-filled sacs, potentially alcohol can, if you have too much of it, can increase your risk of breast cysts. So there's no direct correlation to cancer, but it is something to look out for if you're prone to getting cysts.
Yeah, and alcohol is something that I have done a bit of research into, and I was actually just listening to a podcast this week with someone who also had breast cancer, and she was talking about her journey with it and what the work that she's doing now. And it was something that I was aware of because of personal experience. But even just having one glass of wine every day can increase your risk, and the percentages vary, but they can say from around 14 to 20%, depending how big that glass of wine is. And, it's the frequency of how often you drink that can increase your risk, as well as then the amount you drink. So alcohol is a key one. And again, when you're postmenopausal, is an even bigger risk, isn't it? Because again, of how your body detoxifies the estrogen and the changes in your hormones.
So definitely lots of vegetables to help the liver clean out, whatever's in there. If you do decide to have a drink or whatever, make sure you're balancing it out with a healthy diet.
Yeah, and exercise is another one, isn't it? It's so important. Exercise, lots of things that exercise does, again, in your body, with renewing cells and keeping your heart and lungs healthy and so on. So lots of lifestyle. And I guess that's the thing that you're going to be supporting clients with as well, is building that healthy lifestyle and putting the right habits in place so that they can fully recover and be strong and well post-cancer.
Yeah, so I have 2 actually wellness programs. I have one for somebody who has a new diagnosis of cancer, and they're undergoing treatment about, how to optimize your health and increase recovery times while you're getting your chemotherapy, your radiation, or your surgery. And then I have a regular wellness program for anybody, but also for cancer patients who have finished their treatment and now they're starting over again. Like I said, you're at stage 1 because you can't do what you were doing before.
Yeah. Oh, that's brilliant. And I love that you've got something there for someone who is right at the start of their cancer journey, who may feel really alone and unsure about what's going on, and, be really passionate about protecting their health as they navigate the medical part of their treatment and recovery. So that's fantastic. So I really appreciate you joining us and sharing this and opening up about your own story as well, of course. So, just for those listening, the main takeaway is know your own breasts, get comfortable with them, check them regularly. I'll pop the link to Amy's YouTube video into the show notes. So please go and take a look, see what it looks like to actually check, practice it, put something in your calendar, reminders. There's so much we can go into about building habits because we know how easy it is to go, yeah, I'm going to do that. And then 4 weeks later, there is no, recall of doing the breast check that you promised yourself you would do. So find some way to build it in. Is there any tip that you've got to offer for people doing,
so if you're
like
still
that?
Having your monthly cycle, it's recommended that you check them right after your bleed ends, because that's when our reproductive hormones are at their lowest level. So there's, less chance of having swelling or cysts or anything. It still could be there, but it's a less chance because the hormone levels are lower. And if you're not having monthly cycles anymore, then just pick the first of the month, the 15th of the month, whatever works for you. Another tip that I have, I don't know if this would apply in the UK, but for here, when I was working in oncology, I used to tell women, have your mammogram in your birthday month. That way it's really easy to remember when it's due. And then every year you'd be like, oh, okay, it's my birthday. Did I get my mammogram?
Yeah.
So those are just easy tips.
Yeah, so it's kind of like habit stacking in a way, isn't it? Find something that you're going to be thinking about and tag the breast check or your mammogram onto that, so that it's an easier way to try to remember it. So yeah, really important to know your own breasts and do that regular check. And anything that looks, feels different, remember, it's not just the feel, it's the look as well. Anything at all, do get it checked, and don't be scared is the big message, because like we talk about with health all of the time, you are in control of your health. And so when you take control fast, you are at a much, much greater chance of having an absolutely full recovery and not putting yourself at any greater risk either in the future. So take action and protect your future health. Yeah, great.
I'm actually in the best shape of my life, I think, right now than I ever have been.
That's amazing.
I have more muscle tone than I've ever had. I have more energy than I've ever had. So it is possible.
And do you feel as though that's come because of what you've experienced with both of your cancers, and did that change like your outlook on your health?
So I'll just tell you a quick story. My logo is a phoenix, the fictional bird. And the story of the phoenix, for anyone who doesn't know, is that it burns and then it rises again from its ashes. And so I used to tell my husband every time I went to the hospital, between the lymphoma treatments, and I actually had infertility treatments in the middle of that, and then the breast cancer stuff. And every time I went into the hospital, I said, you know what? Today's my burning day. I'm like a phoenix. I'm going to rise again stronger. And that's kind of my slogan for my business. But it was, a lot of mindset work. Each time I went in, each time I had a procedure, each time I just was determined to come out stronger than before.
Yeah. Oh, that's fantastic. And it's so empowering to hear that and to know that you've really taken your life into your hands. And as you said, you've you've risen from the ashes, and that's where you want to stay and be strong like the phoenix. So yeah, if you want to share with people where they can find out more about you, and I'll pop everything into the notes, because I would love for someone who maybe is struggling with cancer recovery or a recent diagnosis, or they know someone, to connect, and have a chat with Amy about it.
Even, caregivers, because sometimes they're undergoing a lot more stress and stuff, than the patient themselves.
Yeah.
But yeah, so if you go to my website, thewealthofwellness.com, at the bottom, there's a tab that says where to find me, and all my social media links are there. My YouTube channel is there. So you can, DM me on any of the Facebook, Instagram, Pinterest, whatever. I'm on all the places. So the best place to look would be my website. You can get my email address. Everything's on there.
Oh, fantastic. And you do some great little videos with lots of healthy tips on YouTube. I watched the one that we were chatting about with the curry. What was it called again? The name?
Oh, the pav bhaji, yes.
Yes, with the pureed veg in. We were having a conversation recently about getting more veg in, and yeah, thickening the sauce up with all of those great nutrients from some vegetables. So really liked that idea, because I do love any foods with spice and heat in them. So that's a great one to try out.
Yeah, so here's a quick tip for you. If I have a dish like a paneer dish or a chicken dish that it doesn't have vegetables, I add pureed vegetables. And if I have a dish like chana masala, which is chickpeas, that has the protein, the other way. If I have a dish with vegetables like the pav bhaji, I add beans to give it the protein and the fiber. So
yeah, and it's just simple things like that, which often are new to people. The things that maybe have not been part of your style of cooking and how you've been brought up. It certainly wasn't for me, and I've learned lots of new little tips and techniques to add things in and to switch things out as well. I've been using a lot more beans, lentils, chickpeas. I literally love all of those types, and my daughter's really got into them as well. And it's amazing what you can do with them. I've made this incredible dal with the lentils. I would love to be able to make one of the black dals that you can get in a really nice restaurant, but I think there's just some kind of technique they use, and the smokiness that comes from the oven and the way they cook, it's just not something you can replicate easily at home. But yeah, that if you've got any nice recipes for that, pass them my way.
Maybe. I'll look.
Oh, well, thanks again, Amy. I've really enjoyed chatting and finding out more about your story, and hopefully we've really, brought some awareness to breast cancer for this important month to be aware and inspire yourself to take care of your breasts. Thank you.
Thank you so much for having me.
Yeah, you're so welcome.